Good afternoon, Nico Hidefield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Good morning, Mr. Thompson. I'm Paulson, one of the nurses taking care of Mihiraa. Please have a seat. I understand you wanted to speak privately about Mihiraa. Could you please tell me the reason for your request to see me?
Thank you, Paulson. Yes, I'm really worried. Seeing her get so dizzy and almost fall was frightening. I keep thinking, what if it happens again when I'm not there? What if she hits her stomach or hurts herself badly? I'm scared for her and for the baby.
Of course, that sounds like a very scary experience for both of you. It's natural to worry about it happening again. To help me understand better, could you tell me more about what specific things you or Mihiraa have noticed lately? For example, has she mentioned feeling off balance, dizzy at certain times, or unusually tired?
Well, she says the dizziness comes on mostly when she stands up from the sofa or gets out of bed in the morning. She's also been very tired more than before, which I know is part of pregnancy, but it seems worse. She hasn't mentioned any falls before this, but she does hold onto walls sometimes when walking at home.
Thank you, that's very helpful to know. To build a clearer picture of her daily routine, can you describe what a typical day looks like for Mihiraa?
She's still trying to do a lot, to be honest. She works from her home office most of the day but gets up frequently. She still does lighter chores like laundry, loading the dishwasher, and cooking dinner. I've noticed she seems most unsteady in the evenings when she's tired, especially when she's bending down to get pots from a low cupboard or when she's in the bathroom.
Thank you for that detail. It's very helpful. Now let's focus on some practical steps Mihiraa can take to stay steady and prevent falls. A very effective habit is to always rise slowly from a seated or lying position. I'd recommend she pause sitting on the edge of the bed or chair for a full minute before standing up, to allow her blood pressure to adjust. It's also wise to avoid quick turns or movements and to ensure all walkways, especially to the bathroom at night, are well lit. Staying gently active is important for maintaining balance and strength. Safe options include pelvic tilts performed while standing against a wall for support, or seated leg lifts while holding onto a stable chair. Prenatal yoga is excellent, but poses should always be modified using a chair or wall for stability, never holding balances unsupported. To tailor this advice, could you tell me about Mihiraa's daily support system? Does she often spend time alone at home, or is there usually someone available to assist her during the day or night?
I'm at work during the day, so she is alone from about 8 to 5. Her sister sometimes visits on her days off, but most weekdays, it's just her. That's a big part of my worry.
You've raised a very important point about her being alone, and that's precisely why a safe, consistent routine is vital. Staying active isn't just about fitness. It's a key part of her and the baby's well-being. Safe, gentle movement helps maintain crucial muscle strength to support her changing body, improves blood circulation, which can directly combat that lightheadedness and eases common discomforts like back pain. The emphasis must always be on controlled, low-impact activities. I would recommend focusing on exercises like walking on even, paved paths, swimming, or using a stationary bike. These are excellent as they are gentle on the joints, support her weight, and carry minimal risk of a fall. The aim is steady, manageable activity, never pushing to the point of strain or exhaustion. Before we discuss home safety, do you have any other questions, or are there any other concerns on your mind that we haven't covered yet?
No, that makes sense about staying active. I just want her to be safe. Is there anything we should change at home?
Absolutely. Addressing the home environment is one of the most practical things you can do. Let's start with footwear. I'd advise Mihiraa to wear supportive, low-heeled shoes with a non-slip sole consistently, even around the house. Proper footwear provides stability and can prevent slips on smooth surfaces. Next, we can look at some straightforward home modifications. The first step is to remove any clear trip hazards, such as loose rugs, electrical cords across walkways, or general clutter on the floor. For the bathroom, which is a high-risk area, I strongly recommend installing grab bars in the shower and next to the toilet for secure support when standing or changing position. A non-slip mat inside the bathtub or shower is also essential. Ensuring that frequently used items in the kitchen are within easy reach, so she avoids stretching or bending unnecessarily, can also help. These adjustments can significantly enhance her safety. Would you like some illustrated leaflets detailing these modifications and the gentle exercises we discussed earlier to take home?
Yes, please, that would be very helpful. Thank you for taking the time to explain everything so clearly. I feel a bit more reassured and have a better idea of what we can do.
You're very welcome, Mr. Thompson. To summarize our conversation and the care plan for Mihiraa, we've discussed your primary fears about the near fall recurring, particularly when she's alone, and the risk to both her and the baby. We've noted her specific symptoms of dizziness, especially when standing up, and increased fatigue. Understanding her daily activities, like working from home and managing chores, helps us identify high-risk moments, such as bending down in the evening when she's tired. Our key recommendations to prevent falls focus on 3 areas: daily habits, safe activity, and home safety. Firstly, she should adopt the habit of rising very slowly from sitting or lying down and ensure good lighting at night. Secondly, staying gently active is crucial for strength and circulation. We recommend specific exercises like supported pelvic tilts and seated leg lifts, and safe activities like walking on even ground or swimming. Finally, we've discussed essential home modifications, including wearing supportive footwear indoors, removing trip hazards like rugs, and installing grab bars and non-slip mats in the bathroom. I will also make a note in her records about your concerns in our discussion, and I will briefly check in with Mihiraa to ensure she is comfortable and address any questions she may have directly. Please take these information leaflets and don't hesitate to contact the clinic if anything changes or if you have further questions. You're both doing wonderfully.